Hello everyone. In this session, we are going to cover an important topic, that is spread of tumors. So you usually get a long question in your university exams on that. So if you're getting a long question on spread of tumors, you have to write all three ways of spread of tumors, that is lymphatic, hematogenous and transthelomic. Sometimes you get a short question on each of them, so you have to write that portion only. But sometimes you get a long question on the method or the mechanism of the metastasis, in which you have to write all the steps. So we are going to cover everything in this session, so let's start it. The topic, that is spread of tumors, metastasis. Let's start it. First of all, I will let you know the introduction. What do you mean by spread of tumors? Then we will see the various routes of metastasis. Basically, I will be concentrating or telling you there are three routes of metastasis. First is lymphatic, second is hematogenous, and third is transthelomic. In the transthelomic itself, there are three different routes are there. There are three different type of spread in the transthelomic spread. So we will be understanding all three ways. And finally, we will see the mechanism of metastasis, in which I will tell you the 8 steps with the help of the videos. So without wasting any further time, let's start it. Let me tell you the introduction of spread of tumors. What do you mean by spread of tumors? What do you mean by metastasis? What do you mean by metastasis at all? Now, to understand the metastasis, you can see this is a line diagram of a human body. Now, in this human body, let's say this person is having the cancer of any part. Let's say this person is having the cancer of the stomach. So let me draw the stomach here. So you can see I'm trying to draw the stomach. For example, this person can have cancer of any part, tumor in any part of the body. So let's say this person is having the cancer in the stomach, gastric carcinoma. Now, how does it spread in other parts? So, what do you mean by metastasis? So, for example, this is the blood vessel or this is the lymphatic. Some of the tumor cells will loosen from the main tumor and they will enter inside the blood vessel or the lymphatics, and via blood vessel or lymphatics it will spread to multiple other organs, and it will form multiple small secondaries in multiple organs which are discontinuous from the primary tumor. Now in this diagram you can see this one is the primary tumor. This one is the primary tumor, from which some of the tumor cells are dissociating and entering in the blood vessel or lymphatic, and it's spreading into multiple organs. Blood goes everywhere, lymphatic goes everywhere. So via the blood route or the lymphatic route, the tumor cells are spreading in multiple organs. They are extravasating there from the blood vessel and forming multiple masses. These are known as secondaries. So you can see multiple secondaries are there from one primary. The primary is one from which multiple secondaries are arising, and you can see the multiple secondaries which are there throughout the body. They are discontinuous from the primary. Discontinuous word is important and should be highlighted. That is the definition of metastasis. So if the examiner is asking you to define metastasis, how you are going to define? So what is metastasis? It is the spread of the tumor by invasion in such a way that multiple discontinuous, highlight the word discontinuous, multiple discontinuous secondary tumors or secondary masses are formed at the site of the lodgement which are away from the primary. So there is one primary and there are multiple secondaries are formed which are discontinuous from the primary and away from the primary. So they are formed at the site of the lodgement where the tumor cells are lodging. It is the most reliable sign or feature of malignancy. So I hope you have watched my video on benign versus malignant tumor. So there is a video on that. If you have not watched, please watch that. So how to differentiate benign tumor from the malignant tumor? So there are 5 ways to differentiate, but the most important to differentiate is the metastasis. If metastasis is present, it has to be malignant. If it is absent, it has to be benign. So metastasis is the most reliable sign to differentiate the benign tumor from the malignant tumor. Metastasis, the spread of the tumor. Benign tumor do not metastasize, and malignant tumor always metastasize except 2 malignant tumor. All malignant tumor show metastasis except 2. Here, there are 2 exceptions. You have to learn that. What are the 2 exceptions here? Number 1, gliomas of the brain, gliomas of the CNS. They are malignant, so they should show the metastasis. But till now, we didn't found any case of the glioma of the CNS which shows the metastasis. And basal cell carcinoma of the skin. Usually it occurs on the face here and it is known as rodent ulcer. It is also a malignant tumor. So looking at the morphology, they shows the features of the anaplasia. They are malignant, but they never show metastasis. So what we have learned? We have learned the definition of the metastasis. What is metastasis or the spread of the tumor? Can you tell me? So metastasis or the spread of the tumor, here multiple secondary tumors are formed from the one primary tumor which are discontinuous from the primary, and they are formed at the site of the lodgement. They are away from the primary and they are discontinuous. That is the definition of the metastasis. There are various routes. Now this is the most reliable sign to differentiate the benign tumor from the malignant tumor. Benign tumor and malignant tumor.